Have you ever wondered what exactly happens to your body the moment you quit smoking? The changes might be more incredible than you think. In today's video, we're diving deep into the remarkable changes your body undergoes when you quit smoking. From the first month to the first year and even 5 years down the road, we'll uncover the science behind these transformations. Stay tuned to learn how quitting smoking can drastically improve not just your lung health, but also your overall well-being. Some of these changes might just surprise you. The first month after quitting smoking. The journey of healing begins almost immediately after your last cigarette. Within the first 20 minutes, your body starts to respond in remarkable ways. Your heart rate begins to lower, slowly returning to a normal rhythm, and your blood pressure starts to stabilize, reducing the strain on your arteries. These initial physiological changes may seem small, but they are the first indicators of your body's resilience and its readiness to repair the damage caused by smoking. Day 1 to day 7. The initial detoxification process. As you progress through the first 24 hours, your body undergoes a significant detoxification process. Nicotine, the addictive substance in cigarettes, begins to decline in your bloodstream. This decrease triggers early withdrawal symptoms, which may include cravings, anxiety, or irritability. But while these symptoms might be challenging, they are also a sign that your body is starting to adjust to the absence of nicotine. During this first week, changes in your sensory experiences become more noticeable. Scientific studies have demonstrated that as nicotine levels drop, the nerve endings responsible for your senses of taste and smell begin to recover. You might find that food tastes more vibrant and smells become more distinct as your body starts to reset from the dulling effects of tobacco. Weeks 1 to 4. Recovery of lung function and clearing toxins. Moving into the second and third weeks, the internal healing continues. Lung function begins a slow but steady improvement. This is when your body starts to repair the damage done to the respiratory system. The cilia, which are the tiny hair-like structures lining your lungs, begin to regenerate and regain their ability to function properly. Cilia play a critical role in maintaining lung health. They help to clear mucus, bacteria, and other harmful substances from the airways. As these structures recover, their increased efficiency helps to reduce coughing and congestion, contributing to easier breathing. Research shows that the improvement in lung function is not only noticeable, but measurable within these first 4 weeks. Studies have indicated that the forced expiratory volume, a key marker of lung capacity, shows a marked increase. This means your lungs are now better equipped to bring oxygen into your bloodstream and expel carbon dioxide. During these weeks, many people experience a reduction in shortness of breath and fatigue, which enhances physical endurance and overall vitality. A remarkable change in 48 hours. Carbon monoxide levels normalize. One of the most striking transformations happens within just 48 hours. Carbon monoxide, a harmful gas found in cigarette smoke, begins to clear from your bloodstream. Carbon monoxide binds with hemoglobin in the blood, reducing its ability to carry oxygen throughout the body. However, once you quit smoking, the levels of this gas drop rapidly. Within 2 days, your blood oxygen levels start to return to normal, which enhances circulation and provides more oxygen to your tissues and organs. This critical change not only improves energy levels, but also supports the healing of tissues throughout the body. 1 year after quitting smoking. Reaching the 1-year milestone after quitting smoking marks a period of profound changes in your body, both visible and internal. The cumulative benefits of staying smoke-free become increasingly evident, and many of these changes are supported by scientific research. Over the course of 12 months, the body makes considerable strides in healing and recovery, particularly in the areas of cardiovascular, lung, skin, and oral health. Cardiovascular health. One of the most significant changes that occur within the first year of quitting smoking is the dramatic reduction in the risk of coronary heart disease. Research indicates that the risk of a heart attack is reduced by nearly 50% compared to those who continue to smoke. This improvement is due to several factors. First, the blood vessels that were previously constricted by the harmful chemicals in cigarettes begin to widen, allowing for better blood flow. As circulation improves, the heart does not need to work as hard to pump blood throughout the body, reducing the strain on the cardiovascular system. Furthermore, The levels of cholesterol and other fats in the blood begin to normalize, and the likelihood of clot formation, which can lead to heart attacks, is significantly decreased. These changes collectively contribute to a healthier heart and lower the overall risk of developing cardiovascular disease. Lung health. During the first year after quitting, the lungs continue their process of recovery. The damage inflicted by years of smoking is not fully reversible, but significant improvements are still possible. The body gradually repairs the delicate tissues in the lungs that have been damaged by tar and other toxic substances. Many people notice a marked reduction in respiratory symptoms, such as coughing and shortness of breath. This is because the inflammation in the airways diminishes, and the cilia, tiny hair-like structures in the lungs responsible for clearing out mucus and debris, become more effective. Studies show that lung function improves steadily over the year, making it easier to breathe and engage in physical activities without experiencing the discomfort that smokers often face. These improvements can also help lower the risk of developing chronic obstructive pulmonary disease, COPD, and lung infections. Skin and oral health. Quitting smoking also leads to noticeable changes in skin and oral health. The improvement in blood circulation enhances the delivery of oxygen and nutrients to the skin, resulting in a healthier complexion. Many former smokers find that their skin appears more vibrant, less wrinkled, and more evenly toned, as smoking accelerates the aging process and contributes to premature wrinkles. Additionally, the cessation of smoking helps in the repair of damaged capillaries, which further promotes skin elasticity and reduces the dullness that often accompanies prolonged smoking. Oral health also sees considerable improvement within the first year. Smoking is a major risk factor for gum disease, tooth decay, and oral cancers. After quitting, the gums receive more oxygen and nutrients from the improved blood flow, which helps them to heal and reduces the risk of gingivitis and other periodontal diseases. The teeth, which may have been stained yellow or brown by nicotine, also begin to regain some of their natural color as the stains gradually fade. Former smokers also experience fresher breath and a reduced risk of developing mouth sores and ulcers. The most significant change: reduced heart attack risk. Perhaps the most compelling change within the first year is the dramatic reduction in heart attack risk. Studies have shown that by the end of the first year, the risk of a heart attack is cut by about 50% compared to when you were still smoking. This reduction is a testament to the body's remarkable ability to heal and regenerate itself when given the chance. 5 years after quitting smoking. Reaching the 5-year mark after quitting smoking brings about a range of substantial health benefits. The body continues to repair itself, and many of the long-term risks associated with smoking begin to decline significantly. These changes reflect the body's remarkable ability to recover from years of exposure to harmful substances. The reductions in the risk of stroke and certain cancers, as well as overall improvements in health, highlight the importance of staying smoke-free. Stroke risk reduction. One of the most notable changes after 5 years without smoking is the reduction in the risk of stroke. Scientific studies have demonstrated that within this time frame, the stroke risk for former smokers decreases to a level comparable to that of individuals who have never smoked. This is largely due to the healing of blood vessels and the normalization of blood flow throughout the body. Smoking damages the arteries, causing them to become narrower and stiffer, which increases the risk of blockages that can lead to a stroke. Over the course of 5 years, however, the body gradually repairs this damage. The inner lining of the blood vessels begins to recover, and the circulation improves, significantly lowering the likelihood of clots forming in the brain or other areas. This process ultimately results in a stroke risk that is no longer elevated, aligning it with the risk faced by those who have never smoked. Cancer risk reduction. Another major benefit of being smoke-free for 5 years is a significant reduction in the risk of developing certain types of cancer. Research shows that the risk of cancers such as those of the mouth, throat, esophagus, and bladder is considerably lowered. For instance, after 5 years, the likelihood of developing cancers of the mouth and throat is reduced by about 50% compared to those who continue to smoke. This reduction is attributed to the body's ability to gradually eliminate or repair the cellular damage caused by the carcinogens present in tobacco smoke. Carcinogens in cigarettes cause mutations in the DNA of cells, leading to uncontrolled cell growth and the formation of tumors. When smoking is stopped, the exposure to these harmful chemicals ceases, and the body's natural repair mechanisms can work more effectively to prevent further mutations and promote the destruction of damaged cells. As a result, the risk of developing these cancers begins to drop, providing a powerful incentive to remain smoke-free. Overall health improvements. Quitting smoking for 5 years also brings broader improvements to overall health. The body's immune system, which had been weakened by the toxins in cigarette smoke, starts to regain its strength, making it more effective in fighting off infections and diseases. Additionally, quitting smoking reduces chronic inflammation, which is a contributing factor to many health problems such as heart disease, diabetes, and arthritis. Inflammation occurs when the body is constantly exposed to harmful chemicals that trigger an immune response. Once smoking is stopped, the inflammatory markers in the blood decrease, which in turn reduces the risk of developing various inflammatory conditions. Furthermore, overall body function improves as organs such as the heart, lungs, and liver are no longer under the constant assault of harmful substances. This improvement contributes to better physical fitness, increased energy levels, and a higher quality of life. The most significant change: cancer risk halved. Perhaps the most compelling change at the 5-year mark is the halving of the risk of cancers such as those of the mouth and throat. This reduction is a powerful indicator of the body's capacity for healing and underscores the critical health benefits of quitting smoking for the long term. That's all for today, thriving beings. So within just 1 month, your body begins to detoxify and lung function starts improving. By 1 year, your heart attack risk is halved, and after 5 years, your cancer risks significantly drop. Ready to see these changes in yourself? The best day to quit smoking is today. Thanks for watching, and we'll see you in the next video.